My name's Sara Gray. I work for Missing Link Crisis House and I am a mental health support worker. It's quite home from home really. It's for ladies who are suffering from a mental health crisis at present time. We like to feel that we work quite holistically, so when people are in crisis, they can come into the house, we can look at the bigger picture and hopefully twofold get them out of crisis, and secondly equip them with the tools and resources that they can take home with them. We've got 9 beds. We actually work from the social model rather than the medical model. So it's not a clinical setting, it's a very homely setting, and it's a pleasure to work there, to be honest. Anyone can refer into the service, so the GP, CPN, psychiatrist, or you can self-refer. So anybody, it's quite a straightforward process, a quick phone call, a little bit of information given over the phone, followed up by, we call them assessments, but they're more a little chat really about where you are, and that is the referral process. Very straightforward. I would say holistic, definitely, and I think the other 2 words are words that service users have used, and some people have called it a sanctuary, and some people have said it's like a retreat. So it's a very, very, again, because a lot of people are used to working within the medical model, to then be working in the social model, it's a lot different. Work alongside people. We normally only have 2 people to work alongside, so we can really get to know them. We get to look at the whole situation. So my role would be to help people to look at the positives they've already got rather than the negatives and start building on those. Also the practical things, because sometimes it's the practical things that people need some help in. So building on life skills, we do a lot of group cooking, we do a lot of pampering, we do a lot of nails and jewellery making. I would say that for a service user to come in or for their family, it's a lot more user-friendly than a hospital environment. If people are going to work, if people have other childcare, if they've got their children coming to visit, that is all, we can work around that. So people can still carry on living their lives, but just with us as a safety net in the background. We do work quite closely with different services, and we get a lot of other services come in to us. So it always helps us because there's always something we're learning from the services that we can pass on. When someone first comes in, we do what's called an outcome star. So it's from that person's view of where they feel they have got the main crisis going on, whether it's managing their mental health, whether it's self-esteem or one of the other various areas. From that, we then identify and work with the client to see which area they'd like to be working on. So if it was managing mental health, we would be looking at maybe helping find an advocate for them, maybe accompanying them to appointments, lots of practical things. Everyone gets support sessions that are tailor-made for them. So depending on the area we're looking at and that the service user wants to look at that time, we then build support sessions. So it is a crisis service, so it is crisis intervention. So 4 weeks in, out. So it is quite hard work at times because for an hour a day, we do sit with each individual and work on the area that they want to work on at the time. So an hour a day support session. 2 or 3 times a week we then have a group session. Then on top of that we have all the other holistic